Good evening, everyone. Good afternoon or good morning from whatever country you are coming from. And welcome to this first webinar organized by the FIP, the Hospital Pharmacy Section for the Eastern Mediterranean region. Our webinar today is entitled The Hospital Pharmacy Practice and Achievement in EMRO, What Next? I hope it will be a fruitful event where as hospital pharmacists, we are going to learn from each other and to learn from different countries their experience in their practice of this profession that we have chosen. I am the Vice President of the FIP Hospital Pharmacy Section for the EMRO. I have some announcement to tell you. This webinar is being recorded and live streamed via YouTube. The recording will be available on our website, the FIP website, on www.events.fip.org. You may ask questions using the question box provided at any time. And I think we will have at the end of the presentation a small panelist, and we are going to answer all the questions. At the end, you are welcome to provide a feedback to the FIP at webinars@fip.org. And if you like to become a member of the FIP, you can join by going to the website of the FIP, www.fip.org/membership and registration. Our today programs will be divided for a small introduction. Then we will have the Egypt experience, the Jordan experience, Lebanon, Pakistan, Qatar, and Saudi Arabia. 6 different experiences from the EMRO region. This event is organized by the Hospital Pharmacy Section to share the hospital pharmacy practice and achievement in EMRO. So, as I mentioned, 6 different countries will be sharing their experience, and in the future we will have other webinars with other speakers from other countries where everyone will be sharing what they are doing in hospital pharmacy. I'm going to start now with the first speaker. We will have Dr. Hamad Naji from Egypt. He will start by his own presentation. So Dr. Naji is the pharmacy director at the Children's Cancer Hospital, Egypt 57357. He is the founder of the Personalized Medication Management Unit at this center. He is a clinical instructor at Colorado University School of Pharmacy and a founder in the Pharmacogenomics Access Reimbursement Coalition and a founder of the Standardizing Lab Practice in Pharmacogenomics. And he is also a board member in the African Pharmacogenomics Network. Dr. Muhammad, the floor is yours, and thank you for being with us.
Thank you so much, Dr. Waël. Thank you for the FIP for having us today. Today we'll talk about pharmacy, hospital pharmacy in Egypt. I will give a small hint about what we have here in Egypt regarding pharmacy. So let's start with the history of pharmacy in Egypt. The Faculty of Pharmacy, Cairo Faculty of Pharmacy was the first one education institute for pharmacy in Egypt. It was established in 1827. And the education system was based on studying pharmacy for 5 years after finishing the higher school directly on the basis of marks obtained in the final exam without national pre-license exam. In the year 2000, a new credential program has been established in some faculties to graduate clinical pharmacists parallel to the general program. And both the program, which was called the general one and the clinical one, is giving the bachelor degree. While in 2019, the Egyptian Ministry of Higher Education adopted a 6-year pharmacy program instead of the 5-year bachelor degree in pharmacy to be followed by a national pre-license exam as the minimum requirement for a license as a pharmacist in Egypt. Currently, there are around 57 faculty of pharmacists in Egypt and almost from 18,000 to 20,000 graduates every year. And we can see, as you can see, this is from the WHO, which are representing the number of pharmacists in correlation with number of population. So in Egypt, we are around 105 million as a population. So we have 6 pharmacists, as you can see, for each 10,000 citizen, which means around a pharmacist for 1,200, which is a very good ratio. But what you can see right now is also from the WHO, which is reporting that the number of male pharmacists around 22% out of the whole pharmacists, and the rest are females. And now I will give you a real example from what we have from clinical pharmacy in Egypt, and I will talk about my hospital, Children's Cancer Hospital in Egypt. This is a real photo from our hospital. We are totally for free, non-governmental pediatric oncology hospital. We are depending only on donations. And 57057 was established in 2007. Our Department of Pharmaceutical Services and Sciences is fully automated since November 2009 with the Cerner system. Since 2007, we are working 24 hours, 365 days. And currently, we are SHP accredited pharmacy. I'll give you some hints about what we have. So this is one of our clean rooms. We have 3 of them. And every day we are preparing average 3,500 intravenous dose preparations. It's actually a small factory. Regarding the automation, we have a Pyxis system where this is in the ward, and also we have a ROA robotic system, and we are using this for the outpatients. It's actually, I like it so much. It afford for us decrease the number of people working in that area, and also number of pharmacists, in addition to, for sure, the pharmacoeconomics. Regarding the ward pharmacy, we have for every 10 to 15 patients maximum, we have 1 ward pharmacist responsible for those patients 24 hours. So we have pharmacists in the morning, we have night shifts responsible for those patients in the ward. Also, we have a very big daycare unit where we receive every day from 150 to 200 patients per day. We have also what we call pharmacy subspecialties, which I established this section in 2017, and I used to be the head of this specialty before being the director of the pharmacy. So we have radiology pharmacy, radiology pharmacist, nuclear pharmacist, we have operation room pharmacist. In every area of those, we have multiple pharmacists, not only one. We have cardiology pharmacist, we have psychiatry pharmacist, we have neurology pharmacist, nutrition pharmacist, infectious disease pharmacist, and personalized medication management pharmacist. So I will give an example for this only because of the time. So for the personalized medication management, so it's one of the unique models that you have a pharmacy, a lab under the pharmacy umbrella. So in that lab, we have therapeutic drug monitoring, quality control, and pharmacogenetics clinical implementation. For the therapeutic drug monitoring, we are using some instruments which depend on immunoassays, and also we are using chromatography, HPLC, and LC mass triple quad. And we are considered the only clinical lab in Egypt using chromatography for therapeutic drug monitoring. For sure, we have a lot of chromatography machines in Egypt, but mainly in the research and in the pharmaceutical companies, not in a clinical lab for therapeutic drug monitoring. We are currently doing for therapeutic drug monitoring, we are doing aminoglycosides, antibiotics like vancomycin, anti-epileptics, methotrexate, immunosuppressant, antifungals, flusaconazole and voriconazole. And also we are currently focusing on doing busulfan, which will be launched very soon, inshallah, 6-mercaptopurine, chemotherapy, and TKIs. Regarding pharmacogenetics, we are live since 2018. We are doing preemptively for our patients around 8 genes, and those 8 genes are covering around 100 medication. We are only doing this for the medication that have a clinical guideline. And also I'm a member in the CPIC, which is a Clinical Pharmacogenetic Implementation Consortium, responsible for publishing the guidelines for pharmacogenetics. So this is an infographic that can show you how the personalized medication management pharmacist can do it reactively using reactive medicine using therapeutic drug monitoring, or preemptive medicine using pharmacogenetics when you do it preemptively before giving the medications. We also have an PSHP International Pharmacy Practice Residency Program, and we already finished the 5th cohort, and we are now working with the 6th cohort. The good thing is the residents, not only Egyptians, but this year, for example, we have 10 pharmacists from Saudi Arabia. In summary, our Department of Pharmaceutical Service is there since 2007. It's totally automated since 2009, and we are working 24 hours, 365 days. PSHP accredited pharmacy, PSHP accredited residency program. We are currently 130 pharmacists. This are my team, and thank you so much.
Thank you, Dr. Hamad, for the presentation. And good luck for your work in your center.
Thank you.
Now
thank you.
Now, okay. Our second presentation now will be from Jordan. With Dr. Suzan S.Hammoudeh. Dr. Suzan, she works at the hospital pharmacy. She works, sorry, Dr. Suzan is she works at the pharmacy. She is the pharmacy department chair deputy at King Hussein Cancer Center in Jordan. She is specialized in the supply chain management. She received her MCIPS in 2010, followed by the executive diploma from CIPS. Then in 2020, achieved the highest CIPS recognition through becoming a fellow at CIPS. She has also finished the ASHP Pharmacy Leadership Academy program. Suzan has been working with King Hussein Cancer Center team to elevate the pharmacy profession and ensure sustainable accessibility to medication. Thank you, Suzan, for being with us. The floor is yours.
Thank you, Doctor, for the kind introduction, and thank you for the invitation for the FIP team, and thank you for the attendance. I'll start first with a general introduction about our union, the GPA in Jordan, and then I'll share an experience from Jordan, the King Hussein Cancer Center experience. So the Jordanian Pharmacist Association is the umbrella under which all pharmacists in Jordan practice. We must be a member in order to practice pharmacy in Jordan. Currently, there are around 32,000 members in the GPA. There's no functioning hospital pharmacy committee. There's a community pharmacy committee, but unfortunately, we still don't have a hospital pharmacy committee. So King Hussein Cancer Center is a comprehensive cancer center in Jordan for both adults and pediatric. We are dedicated to providing state-of-the-art comprehensive cancer care. Also, we have a mission in education, training, and public awareness and research. This is all in order to decrease the suffering and the mortality related to cancer. So in order to do so, we focus on the sustaining healthcare providers' education and knowledge. We've invested in building capacity of the healthcare providers. Also, as a testimony for the high quality and standard that we practice in our daily work, and in order to ensure continuous improvement and build a person-centered care culture, we've sought several high-level accreditations, among which we have full accreditation for Human Research Protection program at KHCC. And at the pharmacy since 2018, we've also been an accredited pharmacy. We've had the accredited pharmacy residency program. KHCC pharmacy mission is also part of the KHCC general mission. So our department also seeks providing comprehensive cancer care at cost-effective pharmaceuticals. Also, we try to become the leaders in pharmaceutical excellence in areas of patient care, teaching, and also research. So we've focused on building a culture of clinical leaders. So the pharmacists have capacity to participate in decision-making in changing the healthcare system at a national, not only at the hospital level, but also at a national level and hopefully at a regional level. Becoming clinical leaders at any part of their career, whether they're juniors or senior pharmacists, they can participate in continuous improvement and also contribute to sustainable healthcare system. But this will require, of course, empowering the pharmacist. So a quick background explaining how we've started with our mission in 2004. We've started with advanced pharmacy services. Of course, we're Joint Commission accredited. We're clinical guideline also. We have specialized accreditation for the oncology. We prepare our medication in IV. All medications are prepared at the pharmacy. We've also focused on the TPN services that our pharmacy offers, and we've introduced the pharmacovigilance and pharmacoeconomic services for the hospital. And the procurement and supply chain management section also in KFCC has been specialized, and all medication procurement is under pharmacy. We also have a quality care section in pharmacy, and we've been expanding over the years into several new buildings. In order to achieve, we believe in high quality pharmacists. So knowledge is the means to empower the pharmacists. So we have several training programs. We have the internship program. We have the residency, the ASHP accredited program. We also have a pharmacoeconomic capacity building program. We have the clinical training program and the research one-year training program for our pharmacists. We have specialized pharmacists as well working in our pharmacy, because the clinical part is as important as the leadership part. We try to build the leadership skills and also maintaining the clinical responsibility of our pharmacists. We also have 2 certified professional pharmacists in healthcare quality, CPHQ. They're responsible for the continuous improvement and to ensure that we build a culture of a learning organization so that we continue in our mission to improve safety and improve improvement initiatives and projects. This has all reflected in the outcome of our research at the pharmacy. As you can see, the number of IRB approved projects, the published, the abstracts have all grown over the years. Also, the participation of pharmacy staff in non-pharmacy publications and research projects has all improved and grown over the years. Our pharmacy has also been part of the Artificial Intelligence and Big Data initiative at KHCC. So we've had several publications through the pharmacy in this regards. We have predictive models. For example, a predictive model based on the big data that we have for the patients that will be admitted to the emergency room after chemotherapy. And this has been published. We've also had several regional, national, and international awards for our pharmacists and their research and publications over the years. These are examples from the last 3 years. Some of them are international, and some of them are regional, and some are national. And these are the most recent in 2024. We also pride ourselves with the HTA section that we have, Center for Drug Policy and Technology Assessment. It's a specialized section that serves in drug information, pharmacovigilance services, and also hospital-based health technology assessment. It helps in making decisions. It helps in decisions to procure medication, to add them to the formulary, and to better manage our formulary. We've had several international activities regarding the HTA and also several publications in this regard, in addition to the capacity building program in health technology that we have at our pharmacy. For the medication procurement and supply chain management, we've started being part of the pharmacy in 2004, and we've participated in the Basel FIP conference in 2008 for both the clinical part and the procurement and supply chain part. And the statement that came out of this, of the conference, it was procurement of pharmaceutical is a complex process and requires pharmacist control and technically competent staff. Thus, we've invested in building the capacity of the pharmacist in understanding the supply chain and become specialized, whether with the ASCM, the American Society for Supply Chain, or the CIPS, the Chartered Institute of Procurement and Supply in UK. And so we have specialized pharmacists in procurement and supply. This has been an asset for us, especially with the Black Swan events becoming not so rare as they should be, and the VUCA environment where volatility and uncertainty, complexity and ambiguity has become more of a norm. And this also helped us to ensure accessibility to medication, availability of medications, managing shortages in a strategic manner, and even reaching out for our colleagues in several surrounding countries, for example, in Palestine, in Gaza, in Lebanon. Also, we've cooperated with hospitals there to ensure that other patients also can get their medications when needed. Our pharmacy has moving forward, and currently we are working on several projects. We have a pharmacy call center. We have virtual visits for the patients. They can call in the pharmacy and have a clinical consult through virtual means. We also have mail order. We deliver all refill prescriptions to patients' home. They do not come to pick up their medication. The medication is delivered. We've also have a screening clinic for newly diagnosed patients, where patients visit the pharmacy for the first time, so that they can learn about their medication and what to expect in the journey. We've also implemented a barcode medication administration system to inpatients to improve safety, and we have the antimicrobial stewardship program at a national level as well. So that the message here is building a culture, because culture does eat strategy for breakfast. So it's really about empowering the pharmacist with a purpose to impact and ensuring that we have a person-centered care where the pharmacist and the patient is at the center of everything that we do. Thank you.
Thank you, Dr. Suzan, for the presentation. I think you are doing a great job in your King Hussein Center.
Thank you.
Now we will move for the third participant. Our third speaker is from Lebanon, Dr. Ina Adaimy. Ina is the chief pharmacist. Dr. Ina, I need the first slide, please. Okay. Dr. Ina, she is the chief pharmacist at the St. Joseph University Hospital. Dr. Ina, she is a holder of a pharm degree from St. Joseph University, and she has a diploma of hospital pharmacy from University St. Joseph also. She has done her residency at Hôtel Dieu de France Hospital in Beirut, and she has also a diploma in health economy science from l'ISA. The ISA is the École Supérieure des Affaires in Lebanon. Thank you, Ina, for joining us, and the floor is yours. Ina, we are not hearing you.
Okay, thank you, Dr. Waël, for the introduction. And it's a great pleasure with the event. First of all, I will start by defining who is a hospital pharmacist. It's a pharmacist registered. He works in a hospital pharmacy service. He's responsible for ensuring the safe, appropriate, and cost-effective use of medicines. He uses his specialist knowledge to dispense drugs and advise healthcare professionals as well as patients. Requirements as cytotoxics, IV, and parenteral nutrition. He's involved in the development of new drugs. Sorry, I've got some problem. And now I will share with you the Lebanese hospital pharmacist real-life experience. In October 2017, we got a financial and political crisis in Lebanon. This led to a drastic fall of the economic level, a devaluation of the currency, no access to money in banks, no money to subsidize medications, no money transfer, no medication importation. And you can see that we have lots of medication shortages and brain drain. In 2019, again, we have the sanitary crisis of COVID-19 pandemic. And once again, hospital pharmacists need to procure life-saving medications for critical cases that they don't have. In 4 August 2020, we have the disaster of Beirut blast. And this time, the biggest university hospitals of Beirut were destroyed and unfunctional. And now we have the threat of war. All that made a desperate situation, succession of crises and disasters. Hospital pharmacists have lots to do. And they are in the front line. They have to manage with scarce resources. What do we have to do in this case? Have we to wait for better days to come, or do we have to act? If we listen to Abraham Lincoln, he said the best way to predict the future is to create it. That's why we need to move. Hospital pharmacist is a 9-star pharmacist. And he has changed in a word. From a product-focused person, he has been a patient-centered care. In the pandemic period of COVID-19, we had to act and adapt. The hospital pharmacist in Lebanon was responsible for the vaccination of all the population, and he has to deal with drugs shortages. We have to change our all practices, protocols, guidelines, so that we can treat our patients with what we have as medications. In the period of disasters and war threatening, we proved to be champions in our hospital's emergency preparedness plan. So more stars are well deserved. So when needs change, the hospital pharmacist has to change his role to adapt, to develop their practice to meet the changing needs. The most thing to remember is that unity makes force. That's what we started to do to be able to cross these difficult days. First of all, we created a WhatsApp group that contains the contacts of all hospital pharmacists. This allowed us to share our problems and help each other to solve them by exchanging our knowledge and expertise. Seul, that means alone we can go faster, but all together we can go further. We activated a hospital pharmacist committee. It's an official committee working under the umbrella of the Lebanese Order of Pharmacists. It's made of 14 members nominated by the OPL board. It represents the majority of hospital pharmacists from public and private hospitals and from different regions of Lebanon. The work of the Hospital Pharmacist Committee was divided into 3 subcommittees. The Education Subcommittee, Drugs Shortages Subcommittee. The Hospital Pharmacist Status Subcommittee, he has to work on a status for the pharmacist working in hospitals, work to that the hospital pharmacist is better rewarded, and to create new job opportunities for pharmacists in hospitals. In December 2023, a law was decreed by the parliament, Lebanese parliament in Lebanon, called the clinical pharmacist. It specifies the criteria to have the title of clinical pharmacist. It defines the job description and responsibilities of the clinical pharmacist. It tells the minimum number of clinical pharmacists to be recruited based on the number of beds and the critical care departments. Finally,
Ina, sorry for the interruption, but the slides are not moving.
I have a problem. I don't know what is my problem. Sorry, I will. Now it's better, perhaps. It's a success for those working in hospitals. Hospital pharmacists have proven and were recognized for the impact of their role in the hospital healthcare system for the quality of care and safety of our patients. Now, I will move to the Drugs Shortages Subcommittee. Its objectives was to deal with drugs shortages and to reduce chemical waste, the expired medications, and to reduce the financial loss. A monthly list of the life-saving and essential drugs in shortage was communicated to the Ministry of Public Health to raise the voice of hospitals' needs and focus on priorities. And this subcommittee had to work on a list of alternatives and new protocols and guidelines to the drugs in shortage in order to save the limited quantities of drugs to the urgent cases. And we created a Google Drive to share their near expiry medications and exchange them. It was not enough. We need new sources. International medical aid has become increasingly vital as shortages worsen. New tasks for the hospital pharmacist. He has to communicate with donors to receive, check, classify, and manage the stock of donations. And the university hospital pharmacist made a special request for direct importation through the Ministry of Public Health. But not least, I will talk about the Continuing Education Subcommittee, which objectives were meet together, share experiences, help to solve common problems, and to raising the expertise. That's why a series of congresses dealing with different subjects related to hospital pharmacist practices were organized, and a series of quality improvement and accreditation workshops were accomplished. We believe that any hospital pharmacist in any region of the country should speak the same language, the language of quality. It's just the beginning of a long journey to excellence. We believe that it's the time that we will spend together that will rise up the level of our profession. The seed we sowed will grow and bloom into a beautiful flower. And as Antoine de Saint-Exupéry said, it's the time you have wasted for your rose that makes your rose so important. I will share with you this final quote that the stars are guides. For other people, they're nothing but tiny lights. Let us, hospital pharmacists, be the travelers. Let our names be the stars. Thank you.
Thank you, Ina, for the presentation. And sorry for the problem that was faced because the slide stopped at the slide of the table with the pharmacist around it. We did not see the remaining slides.
Oops, I don't know if it's a problem of connection. I don't know. For me, the screen, it was shown.
Okay, never mind. Thank you, Ina, again for the presentation. Now we will move to the third speaker. Our third speaker is from Pakistan. We have Dr. Salwa Ahsan. Dr. Salwa Ahsan, she is a PharmD, MBA. She is a certified pharmacy executive leader by ASHP USA. She is also certified in medication safety and pharmacy informatics from ISMP and ASHP. She is the chief of pharmacy at Shifa International Hospital and Shifa Home Care Services. She is a senior vice president for the Pakistan Society of Health System Pharmacists. Thank you, Salwa, for your presence, and the floor is yours.
Thank you very much, Dr. Waël. I hope I'm audible. Due to some connection issues, I'll keep my video off so that lesser interruptions are there. So I will reopen it whenever there is question answer session. So thank you for having me here today, and I'll be giving you some brief glimpses from the Pakistan and what's happening in terms of hospital pharmacy practice in our country. So to begin my presentation, just greetings from Pakistan to all the participants from around the world. So I hope that someday you will visit our beautiful country and see some of the beautiful sights that I have depicted on my slide and enjoy the delicious food that Pakistan offers. So moving on, I'll just take you briefly through the hospital pharmacy in Pakistan and the spectrum of challenges that actually we are facing here. And just to show you that what are our strengths and what are the areas of improvement, where we want to head in the near future, and what should be our goals coming up. So this slide will briefly tell you about that. So definitely, like any other area of the world, pharmacists are have a very strong presence in the procurement side and drug distribution services. We also are doing very good efforts in terms of medication storage, pharmaceutical medication management, inventory management, recalls, supply chain management, especially in terms of drug shortages, like Dr. Ina mentioned a few minutes back. So this is also a challenge in Pakistan. So definitely a lot of efforts are there in terms of availability of the cost-effective and affordable medications, as well as their continued supply because of several reasons of disruptions that we are facing at the moment. Dispensing remains the core of any pharmacy function, but in our setup, we do still face challenges where sometimes the pharmacists are not present, and a non-pharmacist like a pharmacy technician or others may be dispensing medications still in some part of the country. So that remains a challenge, but overall, it's a good area where pharmacists do present in hospital pharmacies around the country, and they are monitoring and supervising all the dispensing activities. And that goes hand in hand with the patient counseling whenever we are dealing with the patients. So patient counseling is definitely there whenever pharmacist is encountering patients during the dispensing process. Compounding is definitely an emerging field, although it is one of, again, the core functions of pharmacy. But the challenge we are facing in terms of compounding is that the legislation regarding the compounding practices, both sterile, non-sterile, or hazardous products, that has a very brief, outline, and does not correlate very well with the quality assurance part or the quality control part of the compounding services. So that is an area where definitely Pakistan would be heading further in future and developing some of the national guidelines in terms of the quality assurance and quality control of all the compounded medications that are happening within the country. Prescription review, I have put that slightly further on the spectrum, just because there are still areas in Pakistan where prescription reviews is not happening in its true spirit. In many public hospitals, especially, we are getting prescriptions not in a proper form of a prescription, rather a transcribed order of or indent of the medications that is mainly transcribed by a non-physician, probably a nurse. And many of times we have lack of elements of a complete order, or the elements that are required for the proper evaluation of the prescription. That is still happening in some parts of the country. So that we see it as a challenge, that complete patient related information should be available at the time of prescription review, and all orders should be reviewed by a pharmacist. So this is an area that we are definitely working hard on, and we are trying to inculcate pharmacy practice in each and every area, so that all the prescriptions are properly reviewed, intervened, and drug-related problems are addressed. Clinical pharmacy, on the other hand, is definitely one of the very needed entity and is flourishing. Many hospitals have started up full-fledged clinical pharmacy programs, and they have deputed pharmacists on the ward rounds. They're doing multidisciplinary team rounds with the physicians and other team members. They are, providing recommendations regarding medication therapy, adverse drug reaction monitoring, therapeutic drug monitoring, and many other aspects. But still, there are hospitals where proper clinical pharmacy setup still lacks, and they are solely rely on the pharmacist on the hospital area or the compounding area for the dispensing or the preparation of medications, but no clinical pharmacist. So specialty pharmacy, if you talk about, that is again something that is gaining momentum at the moment. There are many pharmacists which have acquired board of pharmacy specializations in pharmacotherapy, in infectious diseases, in TP and total parenteral nutrition, pediatrics, and oncology side. So specialty pharmacy is definitely gaining its momentum, but still, as I said, that since clinical pharmacy itself is not established in most of the hospital, then obviously only those areas where clinical pharmacy is established, the specialization into further areas definitely is happening, but not on all hospitals. Transition of care remains a challenge within Pakistan because of the fragmented healthcare system. Our community pharmacies don't have integration with the hospital pharmacy or the long-term care facilities, and vice versa. So definitely the transition of care do happens at the hospital stage, where most of the pharmacists are involved in the medication reconciliation. They are doing at the time of admission, at the time of discharge. They are doing counseling, patient counseling at the time of discharge, and they are interacting in order whenever there is a transfer of patient from one facility to other. That is happening in a handful of the hospitals, but definitely this is an area of improvement that we need to see in years to come. And last but not the least, the enhanced roles that some of my colleagues today talked about. For example, it could be specialized medications, it could be personalized medications, radiopharmaceuticals, and maybe pharmacist prescribing practices. So those kind of things that I foresee as an enhanced role are still a far-fetched idea for Pakistan at least, but definitely with the going through all these obstacles defined initially, we very hope, inshallah, that those enhanced roles will be soon visible in practice on the grounds. So I'll just share some important milestones achieved as far as Pakistan Society of Health System Pharmacists is concerned. This is a representative body of pharmacists in Pakistan and is also a member organization of FIP. And I'll take you through some of the very important projects that we recently undertook. First of them was National Pharmacovigilance Guidelines, and it was in collaboration with our Drug Regulatory Authority of Pakistan. So historically speaking, this guideline, while it was in process of development, a lot of emphasis was given on the adverse drug reaction reporting and tracking mechanisms. But PSHP integrated with the DRAB, Drug Regulatory Authority of Pakistan, and we shifted the focus, rather we added the focus as well towards the adverse drug events, including medication errors and near misses, in addition to the adverse drug reactions. So for this, the development of the, the guidelines, the pharmacovigilance system within Pakistan and adverse drug reporting guidelines for the healthcare professionals. So the necessary changes in the draft were done with the help of PSHP and DRAB. And this had been enacted almost 1.5 years now. So in addition to development of these guidelines, obviously, the next step was the training and awareness of healthcare staff on these guidelines, because it's a very important entity. So there were different, webinars, online sessions, on-site sessions, training of the healthcare professionals within hospitals. These webinars that we conducted for this, that was a 4-day module that incorporated, basic requirement for pharmacovigilance, both for the hospital, community, industrial pharmacy, and as well as the regulators across the country that were, appointed as the pharmacovigilance focal persons for the collection of data. So that was a big project kind of in which we not only invested on the development of the draft, but also for its awareness and training across the board. Another important project that we undertook very successfully was related to medication safety and was related to high alert medications. And we had a national high alert medication list in line with ISMP, which is Institute for Safe Medication Practices. But that was not, updated as per the current available medications within Pakistan. So what PSHP did with the help of Drug Regulatory Authority, that we updated that list as per available molecules and, made it indigenous for our own country. And then we felt that having a list alone will not suffice, because people need to know that how they are going to actually safely utilize these medications during their clinical usage. So in addition to list, we also developed the high alert medication guidelines first time for our country. And these guidelines were approved by DRAB and notified for implementation in all the hospitals, both public and private, back in September 2022. So here is the list. As you can see, there are 23 medication classes that are listed on this national list of high alert medications, and the guidelines that were developed contains each and every information about all these 23 drug classes, and this guideline is also available on DRAB's website. So this not only encompasses all the drugs, but all the aspects of drug usage, right from the selection and procurement of those medication classes till the dispensing, administration, prescription, monitoring, patient education, discharge counseling, whatever. So all the aspects related to that particular medication is included in the guideline. And I'm very proud to say that we shared these guidelines with the FIP for technical input. And we are very, very happy to tell you that experts on medication safety from FIP Hospital Pharmacy section reviewed these guidelines and officially endorsed them as one of a piece of work that can really bring a change in terms of medication safety in Pakistan, and it includes all the necessary steps from the procurement till the administration and monitoring of these medications. So again, developing guideline was not just the task. We had to, educate our healthcare providers. We have to educate our, regulators on it. because the healthcare commissions and healthcare regulatory authorities, the inspectors involved who were actually the focal persons for implementation of these guidelines on ground definitely also requires some kind of training that what is to be expected and how to actually guide the healthcare organizations on implementation. So we took several sessions across the country in different provinces, and we engaged these healthcare regulatory authorities not only, but also different hospitals and their healthcare professionals in the training of these guidelines and their implementation. So this was something that was really a remarkable achievement. In addition to these on-site sessions, we also conducted several webinars on the highlight medications, and you can see that these range from 1 hour webinar to almost 3 days continuous online modular training on highlight medications. So that not only involved the healthcare professionals from the community and hospital side, but it also involved the pharmaceutical background colleagues, so that even if you are talking about look-alike and sound-like drugs and their packaging and labeling, so we involved them in the training of these guidelines. The third major project that we undertook was regarding the minimum standards of hospital pharmacy practice in Pakistan. So in collaboration with Drug Regulatory Authority of Pakistan, again, we seriously thought that in the previous slide, as I've shown you, that we have a lack of, proper practices in terms of prescription review, in terms of clinical pharmacy, and many other aspects. So why not to have a proper hospital pharmacy practice set up in Pakistan? So we developed this guideline based on FIB Basel statement. We took, some excerpts from hospital pharmacy practice standards from the developed countries, and took help from FIB development goals as applicable in terms of human resource, workforce capacity building, infrastructure, and many other things. And working draft was approved and posted by DRAP for stakeholders comment in January 2024. So this is a very recent activity. So this is just the timeline of this project. In February 2023, you are just looking at my picture. I am presenting this draft to the CEO of the Drug Regulatory Authority of Pakistan that was developed by PSHP. And during March and June, we had several meetings with DRAP officials, and we tried to finalize this draft back and forth. And then finally in January 2024, the draft guidelines were approved and they were posted on the draft's website for the stakeholders' comments. So we hope that by end of April, May in this year, we are going to finalize the first part of this draft, and hopefully, inshallah, later on we'll start with the proper implementation of these guidelines in the grassroots level. So these are some of the projects in pipeline that we are currently working on, the prescription only versus over-the-counter medications. So there are only less than 5% medications which have a prescription only status in Pakistan. Rest of the medications are not yet segregated, and you can very well imagine that how much difficulty would it pose in terms of the dispensing and regulation of medication. So this is one of the very important priority project. The second most important thing is the antimicrobial stewardship, because we have a national antimicrobial resistance curtailment plan, but proper implementation of stewardship activities in the healthcare facilities is the need of the day. So we will be working in developing a national stewardship plan for the antimicrobial usage. And the third important thing, as I mentioned in the previous slide as well, that the compounding standards legislations are quite weak, and they do not contain the quality assurance and quality control standards. So we will be upgrading them as per the best practices and international recommendations. So these are some of the projects in pipeline, and that is all from my side. Thank you very much.
Thank you, Dr. Salwa, for the presentation, and you are doing a great job in Pakistan. Now our fifth speaker is Dr. Anas Hamad. Dr. Anas is from Doha in Qatar. Dr. Anas is the director of the pharmacy department and NCCCR. He is the head of education, safety, and quality. He is adjunct assistant professor at Qatar University, and the head of medication committee and vice president and director at ISPOR Qatar chapter. Dr. Anas, we are glad to have you on with us. The floor is yours.
Dr. Waël, can you hear me and see the slides?
Yes. Now we are hearing you.
Okay, great. Thank you very much, and thanks for FIP for hosting us tonight. So I'll be trying to finish in 10 minutes. I'll be just quickly, my colleagues did great work presenting the advancements in pharmacy practice in the country. I'd just like to quickly just snapshots on Qatar advancement in hospital pharmacy practice. Okay. So, Qatar is a relatively small country in terms of area and population. However, very ambitious country to be always providing world-class services. GDP of Qatar is one of the highest worldwide, especially per capita. Health in Qatar is considered advanced and have positive outcomes generally. Life expectancy is like 80 years. I think even the latest data was 81 years. Qatar spends 11% of its annual budget on healthcare. So this year, for 2024, it's 21.8 billion Qatari riyals. It's around like $6 billion. Qatar also has the highest healthcare expenditure per capita in the GCC. On the International Healthcare Access and Quality Index, among GCC countries, this study was published like 5-7 years ago, and they compared Qatar to Iceland. Iceland has the highest, maybe, index worldwide. And all GCC countries, as you can see, are improving significantly. And Qatar, among those, is the first. And their results are quite close to Iceland in this context. Healthcare providers in Qatar are many. However, the major one is Hamad Medical Corporation, where I work. Hamad is providing the hospital, secondary, tertiary care to most of the people of Qatar. Hamad has 16 hospitals, specialized and general. By general, I mean secondary. We have Sidra Medicine also, which provide women and children care, Aspital Sports Medicine and Orthopedics. And the Primary Healthcare Corporation provides primary care for all people in Qatar. It's 31 centers, but these centers are really big centers that have many clinics and pharmacies and labs and radiology departments and etc. So they are like kind of big ambulatory centers distributed all over the country. Qatar Red Crescent Society also has 4 primary centers providing care for single male laborers in the country, free of charge. For the private sector, we have 8 hospitals, as well as hundreds of polyclinics and healthcare centers and community pharmacies. So I will not go in details, but I just want, this is a part of Qatar National Health Strategy, which is part of Qatar National Vision 2030. And as you can see, comprehensive world-class system, integrated system, skilled national workforce, and national health policy, as well as effective and affordable services, and finally, high-quality research. So the pharmacy strategy in the country, especially in Hamad Medical Corporation, which Hamad Medical Corporation provides around, I would say, maybe 60 to 70% of pharmaceutical care in Qatar. So somehow it represents the pharmacy, hospital pharmacy in the country. In terms of hospital pharmacy, it even provides more than 80% of the services in the country. So our mission and vision in Hamad Medical Corporation is actually to aligns with the national health strategy and looking to have all of these strategic objectives achieved. So all of the pictures I'm showing today are from Qatar and mainly from Hamad Medical Corporation. So inpatient pharmacy services, of course, we do have electronic prescribing system. It has been in place for the last 11 years, I believe. 11 years, we started to have electronic prescribing system across the board. So all of our primary, secondary, and tertiary care is all linked into one electronic health system. So we can track the patient records, the patient prescriptions, everything, lab results, etc., wherever they are in the governmental healthcare sector. We do our inpatient pharmacy is like using the unit dose system. I know some countries still using other systems, but which is the American system, which I believe many of us here are following. We do, of course, provide clinical verifications. So our verifications are not just dose, strength, route of administration, etc., but we do actually go and check if for every single prescription, the lab results, the clinical justification, the diagnosis, and do you know, the clinical interventions where needed. We do also have for the last 15 years automated dispensing cabinets all across all of our hospitals. So no single drug administered, dispensed in Hamad Medical Corporation inpatient setting without going through the Pyxis or Omnicell ADCs. Like I would say 92 or 93%, I think now, maybe we reached 95% are going through ADCs. We do have repackaging robots. We do have barcoding robotics that are providing the pouches that are filled within these Pyxis machines all over the place. We do also barcode medication administration. So I think now we reached 90% or so of our doses are all administered after barcode inspection and double checking. We do we have a corporate extemporaneous preparations manual, and we do hundreds of preparations for some dosage forms using our non-sterile compounding services using the USP 795. For the outpatient pharmacy services, again, every one of the 16 hospitals has a main outpatient pharmacy and some satellite outpatient pharmacies as well. So the numbers of those are more than 100 maybe in total, or more than 80. Again, every order is clinically verified in the same way that, of course, in the outpatient context, but in the same way that I mentioned before. We do have robotics in most of the pharmacies in Hamad Medical Corporation. This picture below is for our Minister of Public Health, Dr. Hanan Al-Kuwari, launching one of our robotics with our Executive Director of Pharmacy, Dr. Mozel Hale. Also, of course, we have separate windows, as you can see. Some of in the other pictures, I don't have the pictures for those, have even more privacy where the borders are, like, I would say, kind of going out more. So more privacy is provided. Some of them were like in the cancer setting in my hospital where we need to give long counseling. We do have also these benches are lower so patients can sit and listen to the pharmacist while sitting, because some of them would need 15-20 minutes counseling on their chemotherapy medications. Narcotics, of course, needs always a special service, a special staff, and all of the regulations that you need to follow. Non-formulary also medication service. Although our formulary in Hamad is very rich, we have, I think we're touching 4,000 medications in our formulary, but still there's always innovative products that are coming new, just approved by FDA, and we want to provide for our patients. And so, especially in rare diseases and cancer and those life-saving conditions. So we do have always in every hospital, there is a non-formulary pharmacist dedicated for this service. Sterile compounding services. Again, every hospital of our hospitals do have a sterile compounding unit, mixing IV products. So we do also follow like the American model where all of our IV preparations are coming out from the pharmacy. So nurses do not prepare except in some areas like emergency and ICUs just on PRN. It's just the first dose, like in the case of sepsis, for example, activation of the sepsis code, just the first dose. But like I would say, 99% of our IV preparations are prepared in the pharmacy. We do follow USP 797, the updated standards. In the cancer setting, we also follow the USP 800 standards. We just moved to our new sterile compounding units like 7 months ago, and it follows the USP 800 standards, which are dedicated for hazardous drugs preparation. We also have a chemotherapy robot preparing chemotherapy solely or independently, and it's linked to our Cerner, our health records. We also are just launching now. We will start using it in the next couple of months. IV workflow management system, which is the one in the picture below, which is also helps to make sure that all of our preparations are provided in the most safe and accurate levels. Clinical pharmacy services have started in Hamad Medical Corporation in 2004, so we're celebrating 20 years this year. Nowadays, clinical pharmacists are essential part of medical rounds, so almost no medical round is taking place, routine medical round, of course, is taking place in Hamad Medical Corporation without a clinical pharmacist being part of it. We have hundreds of clinical pharmacists across HMC. They are involved in so many committees and clinical guidelines development and MDTs, and they are very essential part of all multidisciplinary teams. We extended our clinical pharmacy service to trauma and emergency units. So we have clinical pharmacists actively on the in the bedside in the emergency units around 5 years ago. And also recently we expanded to outpatient clinics where we started to have clinical pharmacy clinics, like medication management clinics for warfarin, for heart failure, for several drugs, and oncology recently as well. We do have, as some of the colleagues before mentioned, we also have an ASHP accredited pharmacy residency program. We started to have this, I think, since 7 or 8 years ago. This was the celebration of our first oncology clinical pharmacist clinic in the MENA region, not only in Qatar actually, for oncology dedicated, and with the help of Dr. Waël actually. We published this in the FIP Hospital Pharmacy newsletter 3+ years ago. It was a big achievement back then because there was no oncology. Most of the pharmacy clinics could be for warfarin or heart or diabetes, but this was the first one in the MENA region to be for oncology. And it's dedicated, as you can see in the room, it's just for us. And we do have actually, when we started 1 day a week, but now we have 10 clinics per week every day. So, and it's now becoming a very essential. So all doctors refer their patients to us before starting their first cycle of chemotherapy. Finally, after many years, although we have clinical pharmacy for 20 years, but finally, just 5 months ago, our clinical pharmacy, in terms of legislation or regulation, got recognized officially as a separate job title, where it has its own scope of practice and registration requirements. Although it's been in practice for a long time, but it's great to have it recognized on a regulatory level as well. We do have many other services, of course. We'll not go through all of those in details, but we have Medication Safety and Quality Center. I'm happy to be the one chairing this one. My colleagues also are actively contributing to many other activities, pharmacy informatics, continuous professional development for our staff, doing so many hundreds of activities, education activities per year, and one major conference every year for us, Qatar International Pharmacy Conference. We do have a drug information center 7 days a week, answering hundreds of calls every day from all over HMC facilities. We do have a pharmacy research center, also represented by all hospitals. We do have a training and licensing section, and this is for training of our students coming from Qatar University or for the pharmacy program, or University of Doha for the pharmacy technician program, as well as also clinical attachment coming from the community. And we, of course, during COVID, as everyone did, we started the medication delivery service. However, many patients found this very useful, so this service was maintained after COVID, and we still actually deliver many medications every single day. This is just some of our research data. This is our pharmacy research report 2023. The data is for 2022. We did have 81 full publications. So these are not abstracts. These are full papers, peer-reviewed publications, 81 last year. And many also others, I think more than 100, it's not here, but more than 100 abstracts also were published. As you can see, 57 posters and 11 awards. These are just the areas where these publications were, were published from. And as you can see, the most areas infectious diseases, and of course, this was boosted by COVID, and oncology and hematology, cardiology as well. There's a growing interest in health economics recently. These are just some snapshot of the publications. Nowadays, we publish more than 30, 40 publications every year just related to health economics, cost effectiveness, budget impact, cost of illness, etc. So growing interest. We still don't have a full HTA system, but the appraising value and considering value and cost is becoming more and more recognized and essential part of our decision making for reimbursement. With that, I conclude, and thank you very much.
Thank you, Dr. Anas, for the presentation and for sharing the experience of Qatar Hamad Medical Center. Now, for our last speaker, we will have Dr. Fakhr Al-Ayoubi from Saudi Arabia.
Good evening, everybody, and thank you very much for FIB for actually organizing such a webinar that is on the 28th of February, which is, we all know that it's the World Rare Disease. I'm glad to be part of this very nice and successful webinar, and I would like actually to focus on some points. Most of our colleagues covered the most important activities that we're doing, and I think role of a hospital pharmacist in the region. But I'm trying now to wrap up the role of hospital pharmacist, try to focus a little on the Saudi Arabia experience. Although I know 10 minutes would not be enough to share our experience, because in Saudi Arabia we started pharmacy in 1978. And our first graduate for clinical pharmacy was in 1983. But again, I'll try to, as much as I can, of course, to go over these slides just to make sure that I can tell you exactly what's going on. In Saudi Arabia, again, money really is a concern. After COVID experience, most of us actually were facing a problem because of, we all know the limitation of budgets, and we also tried our best now to see the importance of cost effectiveness and cost utilization. So we can see that Saudi Arabia is giving a very good amount of money, 50 billion from the annual budget of the country for health expenditures, which comes the third line after education and military. I think this is a proper way of spending the money. But again, we need a teamwork. And why I'm saying that? Because usually what happens is that we are always concerned about teamwork, especially when we're talking about pharmacy. You never find a pharmacist who's working alone. So we have to embed a very important, I think, concept in our practice. And we'll talk about this in the coming few slides after I talk a little bit more about Saudi Arabia and the sites and the pharmacist experience there. I'm going to try to emphasize on the hospital pharmacist activities and authorities that we are gaining these days, and of course the role of pharmacist and medication and maybe even disease-oriented and so on. So you can see now the pharmacy workforce is very important, not just for Saudi Arabia, around the world. You have to study how much pharmacists you need so that you can emphasize on graduating a proper number of pharmacists. So this is how we started in Saudi Arabia. In the beginning, we had only one college of pharmacy, and that was up to 2000. And then after the year 2000, the number of colleges of pharmacy were just actually increased to 27 college of pharmacy. 5 of them were government and the others were private. We were trying actually to produce a lot of qualified pharmacists for the country, because we know how important they are to the community. And we can see that we really did a good job, because we have about 9 per 10,000, 9 pharmacists per 10,000 population, which is a very good number that we achieved after almost 15 years of increasing the College of Pharmacy numbers in Saudi Arabia. We had 4 started the bachelor degrees, and now we have PharmDs. And again, we have very good achievements in the residency program. We started in the 1990s with general hospital residency programs that was accredited from the Saudi Health Council. And then after that, we also had some of the ASHF and ASHP and AEPH, American Pharmacy Association programs, where we had to collaborate with them in some specialty of pharmacy. Again, we tried our best to focus more on the gender also. The pharmacy profession were more into a male actually profession. You can see now the number of female pharmacists jumped up to be up to almost like 12%. We have a good number now of female pharmacists covering even the community pharmacy, because we're trying, as I told you, to have a good number of both genders and a good number of national Saudis in the field. And we can see that the proportion of male to female has really been improving in all sectors. But we were trying to focus more on the community pharmacy, because we are using community pharmacy now as a site of counseling and a site of chronic disease monitoring that I'll try to share some of the information in the coming few slides. Pharmacy profession, as you could see, in Saudi Arabia, we have all type of pharmacy profession. We have academicians, we even have hospital pharmacists, graduated as a hospital pharmacist, industrial, and of course, general pharmacist, clinical pharmacist. But our pharmacy profession did not stop there. We also had our Saudi FDA that were very important in putting the administration and the regulation of the pharmacy profession, as well as the pharmacy informatics. And it was actually introduced to the colleges of pharmacy, and we have graduate pharmacists with an IT experience coming from different sectors in Saudi Arabia. Community pharmacy, we were focusing a lot about it, because we found that 70% of our medications were actually expended and were distributed and were dispensed from community pharmacy. So that's why we had to also focus on it on the top of the hospital pharmacy, which is out of the scope of this webinar. Now, number of Saudi pharmacists, you could see now we are doing really a very good job. We have a very good number now of Saudi and non-Saudi. We also have a very good distribution of primary health centers, which we are attracting a lot of good pharmacists there. It's not the best that we can do, but I'm sure we're going to do much better in the coming few years. Academicians also, we have now our own pharmacists who are teaching, because before we were adopted by Egypt, and they were actually doing a very good job with Syria and Iraq in order to build our first clinical, college of pharmacy. But now we have a national academician that are teaching our pharmacists. A hospital pharmacy, it's almost 30% of our pharmacists are there. And what I think is very important for us here is that actually it's not the number. And I do believe that every time I present the data of Saudi Arabia, I always tell them it's not the number, it's the quality, it's the authority that we have to fight for. It's actually what you really need to know about your profession and where are we heading. And this is what we are lacking since the beginning, and not just in Saudi Arabia, in the area. So now, because we know what's our goal, because we know more about our career and profession, we are doing much better, and we are really having a very good outcome, either in the private sectors or in the governmental sectors. And you can see a lot of authorities are given to the pharmacists now. Okay. Hospital pharmacy, again, in Saudi Arabia, it's not a clear, actually, pathway. We have different natural we'll say, regulations of hospital pharmacies. We have a pure governmental, we have a pure private, and we have those that we call them a government with a mixation of a private, which we call them the health centers, because they are run by the Ministry of Health. But again, the budget comes sometimes from another sector. So again, these actually three types of hospital pharmacy makes it a little bit good because we have lots of challenges, I know, but it's a very high competition area where we are trying to focus on the positive part of it. Industry, we have a lot of manufacturers now. We started only one, a Saudi manufacturer. Now we have more than 40 Saudi, pure Saudi manufacturers of drug actually products and IV and solutions in Saudi Arabia, which means now we are heading towards national regulations for the proper production and bioequivalence of our products in the country. Another very important achievement that we did last year, one of our local Saudi company were able to produce the first biosimilar that was produced in Saudi Arabia, not just packing. And this is by itself was because of the COVID actually crisis that happened, which really motivated our national industry to work on producing their own medications. Again, back to hospital pharmacy. That was just like an introduction, but I want to tell you about the services that we have in hospital pharmacy. Now, regardless of what type of hospital pharmacy we are talking about, of course, administration, and we are even part of the quality teams in the hospitals, the P&T committees, sometimes even we are part of the CEO offices and so on. So pharmacists there, they are part of the administration, inpatient services with all concepts, even the unit dose. And I was lucky to work in the first unit dose that was started in Saudi Arabia. And I was trained, I was only a student when they started it. And I saw how important unit dose is, for example. We have also, of course, the TPN, the IV, and the compounding, and the chemotherapy, and so on. All this has been already well established in Saudi Arabia, and hospital pharmacists are not just in charge of doing them, they are in charge of actually producing the also guidelines, and later on also the national regulations of such services. And it is hosted and under the umbrella of the Saudi Pharmacy Society. So it's important to have not just a national pharmacist, but also you need them to be expert and also to have an ability to do their own regulations. Ambulatory care, and this is actually a part of what I'm telling you, a community pharmacy, but under the regulations of hospital pharmacy. Narcotic medications, and it's a well-established units, and we have regulations for it, and we all know that they have different regulations and a pathway to manage. Drug information centers, our center was started in 1982. It was also accredited by the American Society of Hospital Pharmacy, and it was the only in the Middle East to be able to cover poison cases. Clinical pharmacy services started in, as I told you, in 1984, where there was assigned clinical pharmacist rounding with the ICU patients specifically, and some critical area where there was only a few number of pharmacists there. Medical supply, it is run by, of course, pharmacists who have been trained also for such inventory and equations for the drug stocks and so on. Medication safety and pharmacovigilance. It's a very huge area now in Saudi Arabia. And I saw Dr. Salwa is doing a very good job. And I think that is very important because part of not just actually having a role in authority of pharmacy career is actually to regulate and prevent the medications error from happening from the beginning. Quality improvement, and as I told you, we are part of all the KPIs in the hospitals, regardless of which department they come from. So hospital pharmacy has a very important service, and effectiveness is very important for us. We work as a team, not just with ourselves, also with the departments around us. We also started something called the IV admixtures team, which is part of nursing and pharmacists, not just preparing, also monitoring and double checking. We had also the accountability because, as I told you, we are a reference now for most of the countries around us in the regulations and some of the consent forms, adaptability, and this is very important because most of us has like a different background and experience. Some have been trained in UK, the others in US, some of them even local trained. So what we're trying to do is adopt what's good and try to get our experience embedded inside the final results of guidelines and, of course, of pathway of our work. Excellence is our target, and you can see that in the coming few slides. And the very important thing is that we should respect the career, not just the pharmacy career, the teamwork career overall, so we can work in a smooth way. As I told you, hospital pharmacy, part of it now is the ambulatory care. And it's part of it, hospital, the other part is community. That's why we have now a pharmacy-led clinics, and it's for diabetic patients, for vaccines, and now we had the first one also in the heart failure. Again, you know that ambulatory care is part of the outpatient services. It's also counseling, and it's very important because we have to be there as a pharmacist. And sometimes, as I told you, we do our own practice and experience in prescribing the medications for the patients. Extemporaneous preparation is part of the ambulatory care now. And of course, attending the clinics with the physicians is our target. And this is what we did, and we had a very good job. Now, these are the sites that you could see that we are there. Oncology, even we have now 2 months back, a lipidology clinic that is a merge between cardiology, endocrine, and family medicine, and clinical pharmacists on the top with a metabolic syndrome experience. Again, the more I'm going to talk about pharmacy and hospital pharmacy in Saudi Arabia, the more I'm going to focus more and more about our goals. And as I told you, our career and our target. Ambulatory care, very important for us to pick the proper pharmacist and, of course, give the authority, update the pharmacist, and give them very good experience to be able to take over. We have logistics and strategies to do that. It's always updated, and always try to focus on how to improve the service there. Narcotic drugs, again, rules, regulations, and very important is the documentation. Clinical pharmacists are very important there, and they are part of the hospital pharmacy service. We have other types who are covering the community pharmacy outside. We're not going to talk about them today. These kind of hospital pharmacists, they have to be either master graduate, or they can be a PharmD with a 2 years residency to be able to be called clinical pharmacist. We orient them, of course. We take them to the other part, which is the clinical skills and experience. They are very important, of course, as you know, in the clinical function. They are part of the education program, and they are part of the medication, education, and safety program. Now, again, we are there to document our work and intervention. We are having also a KPI for that, for our clinical pharmacists. We are part also now, not just only in rounding in general words, we are even part of the rare disease clinics, where it's very important for us because, you know, rare disease, most of them, they are lacking of two things, either the diagnosis or the medications. And we all know that rare disease medications are very expensive. It's very important, very crucial to have a pharmacist there. And that's why we thought that part of the training programs is not just to train a pharmacist about how to function in a hospital. It's even more beyond that, how to function with a cost-effectiveness background and a clinical efficiency, of course, experience. That's why also we had to focus very, I think, it's very short time to talk about, but very extensively on the pharmacoeconomic and how we can tackle this with our team and our colleagues in the healthcare practice. The same thing also, we're talking about pharmacovigilance. We're talking about things that are even beyond now this presentation. Again, as simple as that, medication safety programs and problems were taken into consideration. We're even taking even further with the Saudi FDA regulations. So we want to make sure that we are limiting these problems, we are controlling them, and we're stopping them from happening. So we are caring about the patient. Again, in Saudi Arabia, we thought that part of the solutions that we can do in saving money, having a proper medication and proper treatment, is to be part of a team. What do I mean by that? We actually were in a fan of having specialized programs, and we call them multidisciplinary models. We did this in diabetes. We did that even in hyperlipidemia, and we are doing that now in cardiology with heart failure patients. I'm glad I was part of this Center of Excellence. That was like 2015. And it's very nice experience. It's not just diagnosing. It's after you diagnose the patient, you put the proper treatment plan, which is, I believe, maybe Dr. Waël will support me later on. The pharmaceutical care concept that was actually introduced by Hitler in 1980. He was trying to tell us as a pharmacist, it's not just to be a clinical pharmacist, it's to be an effective pharmacist in your career. Either you're in the hospital or wherever you are, you have to know what to do and how to solve problems. So we worked in one team and were able to save patients' life, and that was really very important. We reported that even to the Ministry of Health, also the Saudi Heart Association, which is actually the umbrella of the heart specialists in Saudi Arabia. We're actually very important site that really supported this. And now it's the trend in Saudi Arabia. We have this healthcare specialized multidisciplinary team, and we did a very good job and very good results, and even we published that. So I believe that hospital pharmacists are very important, not just even in a specialized area, even in the public, when we talk about screening, educations, and so on, they're important in diagnosis. So they will take over having the proper treatment management plan, monitoring the patient, getting the outcome, publishing your data, and so on. Now we finished from this very, I'm going to say, condensed information to pharmaceutical care implementation. And why I'm just touching base a little on the community pharmacy, because even in our independent or dependent pharmacy chain in Saudi Arabia, we have a hospital pharmacist trained with a specialized degree to cover the community pharmacy, where we are counseling chronic patients like diabetic and cardiac patients, because they are really saving our patients from coming to the hospitals. And they were very good, helpful, actually, tools for us. And they were defending our pharmacy career when COVID was there. They were the one to dispense medications. Patients were not able to go to the hospitals. So they were very good prepared soldiers for us outside. Another very important thing for us is that we are trying to have a specialized community pharmacy clinical pharmacist who are graduated and having a diploma from the either Saudi Pharmacy Society or the Saudi Heart Association, depends on which disease we're talking about, in order to have them qualified to even manage the patients with the point of care tools, and not even to let them reach to the hospital, to save money, first of all, and of course, to help reaching the patients in an easy way. You can see you have lots of achievements and lots of documents to talk about. Very short time just trying to tell you that the post-graduation is doing very good now. We're even having a residency program specialized, not just in clinical pharmacy and all the pharmacy specialty. We even have in pharmacoeconomics now, drug information, poisoning. And the Saudi FDA has been doing a very good job in regulating the medications and the bioequivalents, biosimilars, and so on. Medication safety is a very important center here in Saudi Arabia now. It's an entity by itself. They report directly to the Ministry of Health, because we want them to be as strong as Dr. Salwa said, as strong as a competent person who's able even to do regulations and implement it. It's not just only going through a process of doing paperwork. It's after you do this paperwork, you make it implemented and you see the outcome. Now, maybe next in Saudi Arabia, we are now trying to focus more and more about social media, about internet, about websites. We want to reach to the public now. Even not just that, we want to educate them, we want to prevent some disease that is really preventable. So we are in advance now of having a prevention and specialized community and a community, family medicine pharmacist. And again, robots are there. They're preparing our chemotherapy. We are talking about nanotechnology now. We are in advance now talking about how we can use artificial intelligence in some of our pharmacies in the hospitals in order to take the pharmacist outside the pharmacy to serve with the patients. Again, I think the sky is our limit. Patient safety is very important. We are all focusing about patient care, not just in Saudi Arabia. I can see all my colleagues who are having the same focus, which is the patient care. I know that maybe this is the first time we hear each other, we see the experience of each other, but I'm definite and I'm sure that together we can do a very good job. And this journey is really very important to sail to the proper place that they're supposed to be there, in a safe and a effective manner. And I believe that healthcare professionals really need a guide and a leader to take them to that place. And I believe pharmacists with any background could do the job because, again, we know a lot, we have lots of experience, and we really learned how to work with a team. Thank you very much.
Thank you, Dr. Fakhr, for the presentation. I think now we come to our end of this webinar. A small wrap-up and conclusion of what we have learned today. I think we are all talking the same language, especially in our region. We have common problems together, and we have seen the advancement in each country with our practice. According to the title of this webinar, it was the end of it, what next? I think next we will have to expand our communication together and our channels of communication between all hospital pharmacists in this region. So be ready to have more webinars with speakers from EMRO region focusing on our practice, and hope it will be in the near future. Because we have exceeded our time allocated for this webinar, we will not have any questions. At the end, I want to thank all the panelists today for their participation and for the organizing committee from the FIP. And I want to end our webinar for the slide on the 82nd FIP World Congress of Pharmacy and Pharmaceutical Science that is going to take place this year during 1 to 4 September 2024 in Cape Town, South Africa. Hope a lot of you can attend this and share what FIP is preparing and our experience from EMRO to be shared with other and different members from the FIP. Thank you again for your presence. And if someone, as you mentioned before, would like to be a member of the FIP, he can visit the website of FIP and go for the membership link and see what is recommended to be part. Thank you again all, and see you soon.
Thank you, Waël. Thank you, everyone. Thank you very much.